Welcome to the She Found Motherhood podcast. On today's topic, we are talking all about nausea and vomiting in pregnancy. This is such a common thing that pregnant people deal with, and there are some really simple tips that many people don't know about that can make a huge difference. So today we're going to talk about our top 10 tips to help you manage nausea and vomiting in pregnancy. We'll get to it right after this short reminder.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Welcome back to the She Found Motherhood podcast. On today's podcast, we're going to review our top 10 tips for managing nausea and vomiting in pregnancy. And this is a super relevant topic for many pregnant people because up to 80% of pregnant people experience nausea and vomiting in pregnancy, and between 3 to 6% of pregnant people experience severe nausea and vomiting, which we commonly refer to as hyperemesis gravidarum. Now, just thinking about what to expect in terms of nausea and vomiting in pregnancy, because people often ask us, the symptoms usually peak, meaning they're at their worst, around 9 or 10 weeks and generally start to improve by 16 to 18 weeks of pregnancy. Now, unfortunately, for some pregnant people, these symptoms actually persist through pregnancy. Around 20% of people will have symptoms until their third trimester, and for 5% of people, their symptoms persist right up until delivery. But what we want you to understand is that just because it's common doesn't mean it's something that pregnant people just have to deal with. In fact, it's quite the opposite.
Nausea and vomiting of pregnancy can significantly impact your quality of life, your mental health. It can increase anxiety and worry about how it's affecting the fetus, how it's affecting your ability to work, and it can also impact your relationships. Now, the thing is, even if it's just mild, we want to know about it. Sometimes pregnant people don't mention their symptoms to us, worrying that they're too mild and they'll just be brushed off, or worried they'll be offered medications that they're concerned about taking in pregnancy. Even if your symptoms are mild, we've got many tips and tricks that we'll get to soon to help you manage your symptoms.
Also, because nausea and vomiting of pregnancy, which is commonly referred to also as morning sickness, is what we call a diagnosis of exclusion. And so what this means is that we, as your care providers, need to make sure that there's nothing else going on causing your symptoms. Just because you're pregnant doesn't mean that we're simply going to brush off symptoms. We need to review your symptoms and make sure that we're not concerned there could be something else at play contributing to how you're feeling, like thyroid abnormalities, side effects of another medication, or substance use. For example, marijuana can sometimes be thought of as a treatment for nausea and vomiting. And we'll talk more about cannabis in another episode, but chronic use can actually be an underlying cause for nausea and vomiting. And then additional things we need to exclude include infection, an underlying eating disorder, and several other less common causes like migraines or even more rare hormonal causes.
But before we get into our top 10 tips, we wanted to talk a little bit about what causes nausea and vomiting in pregnancy. Believe it or not, the cause of nausea and vomiting in pregnancy is not entirely understood. Hormonal changes are thought to play a significant role, including elevated levels of estrogen, though the rising levels of beta-HCG, human chorionic gonadotropin, which peaks in the first trimester, that's a mouthful, is actually thought to be significantly contributing to these symptoms as well. Additional theories include abnormal gastric motility, so meaning your stomach may empty more slowly than usual. We can blame progesterone for that one. And what's really interesting that it's not just the hormonal or gastric changes that occur, but how our body responds to these changes that make some pregnant people more likely to experience nausea and vomiting. Genetics, including family history or personal history, is often thought to play a role. So if your siblings or mother had nausea and vomiting in pregnancy, there is a good chance you may experience it as well.
Okay, so now for what you've all probably tuned in for is our top 10 tips to manage nausea and vomiting in pregnancy. Starting with tip number 1, stay hydrated. It's so important to stay hydrated in pregnancy. Your blood volume significantly increases in pregnancy. And if we don't stay hydrated, you can get dehydrated really easily. And when you're feeling nauseous around the clock, it can be really tricky to keep up with your fluid intake. So, a few things we recommend to stay hydrated include trying to drink your water between meals instead of at meals and just sipping on water throughout the day rather than trying to sit down and drink a big glass all at once. This can minimize the effect of an overly full stomach, which can often make nausea worse. You can even just avoid drinking fluids around meals altogether to avoid that overfull sensation and to allow yourself to maximize your fluid intake between meals and your nutrient intake at meals. Now, fluids that are best tolerated by people who are experiencing nausea and vomiting include cold, clear, and carbonated or sour. So, ginger ale, lemonade, popsicles, and taken in small amounts. Some other ideas include sniffing fresh lemon, drinking lemonade, or eating slices of watermelon. And last but not least, I don't think there's any scientific evidence, but we have heard anecdotally that some people find it easier to get more fluid if they sip water throughout the day through a straw rather than drinking from a glass.
Who knew? Number 2 tip is change the way you eat. So instead of eating, say, 3 large meals in a day, try to eat smaller but more frequent meals throughout the day. A lot of people with nausea and vomiting in pregnancy find that they need to have something in their stomach all of the time. So this includes an early morning snack, as often the nausea can be the worst when your stomach is empty first thing in the morning. Having a snack on your bedside table, some crackers, some cashews or almonds can be really helpful. And have that before you get out of bed, especially if it's worse for you in the morning. In terms of what to eat, it really depends on your individual tastes and triggers. Some people find that protein is more tolerable than fats and carbohydrates. So find out what works for you. We've got some great podcasts with some of our favorite nutritionists, and we'll make sure we link them in the show notes below. And they really dive into the specifics of using food to manage pregnancy symptoms. We also recommend trying to eat more slowly than usual to prevent that overfull stomach that Sarah was talking about when drinking water, because this can worsen nausea as well. And last but not least, try to get out for short walks after meals. This helps to get your digestions going and help that gastric emptying or helping to move the stomach contents through to the small intestine, which will help decrease the nausea.
The third tip we have here is to avoid your triggers. Now, this may sound obvious. It's really important to understand that everyone's triggers are totally going to be different. Some common triggers are stuffy rooms, specific odors like perfumes or chemicals, specific foods or smoke. Heat can be a trigger, humidity, noise, and even visual motion or physical motion, so flickering lights or driving in a car. Excessive exercise, excessive fatigue, foods or snacks that are really high in sugar, spicy foods, or high-fat foods. Yes, I just went through a huge list, but the idea behind that is just understanding that something may sound super weird, but it could absolutely be a trigger for you. And if you're not really sure, then start keeping a journal or note on your phone, and you might start to see trends. So you might notice that you're more nauseous, the more fatigued that you are, or when you eat high sugar foods. And then hopefully what you can do is to start minimizing your exposure to those triggers to reduce your nausea.
Number 4, and this is my favorite tip, but often the most challenging, is sleep. So fatigue can worsen nausea and vomiting in pregnancy, and we know that sleep requirements also increase in early pregnancy. We as healthcare providers have a liberal approach towards recommending increased rest and leave of absence from work to support pregnant people throughout nausea and vomiting in pregnancy. If you're struggling with sleep or feeling like you're not supported in getting the rest you need or modifications at work, reach out to your care provider and see if they can advocate for you. We've got some great sleep handouts as well that you can download. You can find it at www.shefoundhealth.ca/sleep tips, SLEEPTIPS. And this can help you optimize the sleep that you are getting.
Our fifth tip is to give acupressure or acupuncture a try. Both acupressure and acupuncture treatments help some pregnant people with nausea and vomiting in pregnancy. So the evidence out there suggests that about 30% of pregnant people will find these treatments that can relieve symptoms. And this is at the P6 acupressure point. And it's the point that's found 3 finger breadths above the wrist in between 2 tendons. And what you might know is their C-bands is what they're called. You can get them on Amazon. We can link some below. They're acupressure bracelets, and they stimulate the same acupressure point on your forearm. And some people find these really helpful.
Is this pain I'm feeling in my pelvis normal? Should I do genetic testing for chromosomal differences in my baby? Is it safe to go to the dentist while I'm pregnant? Doctors and maternity specialists Sarah and Alicia are here to empower you with even more knowledge so you can have the best pregnancy, birth, and postpartum experience you can. Presenting the Pregnancy to Parenthood podcast, a new series of informative episodes geared week by week toward whatever trimester of pregnancy you're in. Tune in weekly, following along relevant topics as you move through pregnancy, or just binge listen and come back to the episodes you found most helpful. Access the full series for a full 2 years and listen to it on your own time. To learn more, go to www.shefoundhealth.ca or click the link below.
Tip number 6 is change up your vitamins. So some pregnant people may find that the chewable prenatal vitamins are more tolerable than tablets or capsules. If you're not able to stomach prenatal vitamins at all, a supplement containing folic acid, 400 to 800 micrograms daily, is recommended until you can tolerate those prenatal vitamins. You can also take a kid's chewable with your folic acid. Some of those prenatal vitamins are really big,
Like horse pill.
and they also have some iron, which is actually really poorly absorbed, but can contribute to your nausea as well.
Okay, so moving on to number 7. And this one may sound funny, but bear with us. It is modify your dental care routine. So many people find that brushing their teeth after a meal, spitting out saliva, and frequently washing out the mouth can also be helpful. That being said, a lot of pregnant people also find certain toothpaste flavors triggering. I remember when I was pregnant, I used to use like Arm & Hammer baking soda. Since pregnancy, I have not been able to use that. I could not use that. So I had to switch brands and have just continued on. So consider switching to a different toothpaste brand. It may not be all toothpastes. It may just be the brand you're using. And that might be helpful for if you're finding like a mint flavor or specific flavor toothpaste is a trigger for you.
Number 8, give vitamin B6 a try. So vitamin B6 is also referred to as peroxidine. It's a water-soluble vitamin and has an excellent safety profile. And given that it's a vitamin, many pregnant people are comfortable starting here. As a single agent, the recommended dose of peroxidine is 10 to 25 milligrams orally every 6 to 8 hours or 3 times a day. The maximum treatment dose suggested for pregnant people is 200 milligrams a day. So studies have shown that it can be effective at improving mild to moderate nausea, but doesn't really reduce vomiting.
And tip number 9, one of my faves, is get your Zen on. So this is really interesting. I love looking at the literature. And there was this study that looked at vitamin B6 alone, so the one Alicia just talked about, or combining vitamin B6 and mindfulness-based CBT. And what this CBT stands for cognitive behavioral therapy. And this study found that mindfulness-based cognitive therapy in combination with vitamin B6 helped pregnant people reduce their symptoms more, when it also improved symptoms of anxiety and depression. And there's some evidence that stress can worsen nausea. So if you're really wanting to avoid medications and you're looking at modalities that will be beneficial, not just for nausea and vomiting, but down the road, honestly, in life and definitely in parenthood, then consider some mindfulness-based cognitive therapy. And there's a lot of great programs in our community that your physician can refer you to.
Yeah. And last but certainly not least, our final tip is to talk to your provider about a prescription medication. There are many safe medications you can take to manage nausea and vomiting in pregnancy, including the well-known combination of doxylamine and peroxidine. So remembering peroxidine is that vitamin B6 and doxylamine is a first-generation antihistamine, and that combination can help decrease nausea and vomiting in pregnancy. It's a combination treatment that appears to be more effective than either drug alone, and its safety has been well established in pregnancy. Important to note, though, that this medication is more for prevention than for treatment. So if your nausea is worse in the morning, take it before bed. If it's worse in the afternoon, take it in the morning. You get the idea.
And then if despite lifestyle modifications, dietary changes in combination with the doxylamine peroxidine is ineffective at managing your nausea and vomiting, then we typically look at medications that are targeted to more severe symptoms. And that's an individualized conversation that you can have with your care provider. So there you have it, folks, our top 10 tips for managing nausea and vomiting in pregnancy. And we invite you to head to our website, www.shefoundhealth.ca/NVP. That's NVP for nausea and vomiting in pregnancy. And you can download our free guide to managing nausea and vomiting in your pregnancy. And we'll also link that in the show notes below.
And again, as always, if you have any comments on this podcast, if you have any questions for us, Feel free to email us or shoot us a DM on Instagram, and we're happy to get back to you. Again, we don't give specific medical advice, but general questions we always love to hear from you.
Thanks for listening.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.